Hi, everybody. I'm Gwendolyn Sterk of Sterk Family Law, and I am happy today to be here with my friend Alexandra. Hi, Alexandra.
Hi, Gwen. How are you?
I'm great. How are you doing?
I'm doing well. Thank you so much.
Good. Can you tell us a little bit about yourself and what it is that you do?
Sure. I am the owner of Glumac Consulting Group, and what my company does is work with small to medium-sized businesses, and we help with HR needs. So anything related to HR documentation, like employee handbooks, job descriptions, employee performance evaluation systems, things like that, I assist in writing those documents. We've created a lot of policies and procedures as well, so that's something else that I can assist with. And then we also do a lot of training, and my specialty is professional development training, or as it's known, soft skills training. So I go into the workforce and help with everything from conflict resolution to communication, maybe customer service, team building, leadership, and then also employment law types of trainings like sexual harassment and things like that.
Very good. You know, I know that also you have background in mental health, and you're able to really talk about what's occurring in trauma to different individuals that they may be experiencing related to COVID. Can you give us a little bit about your background in mental health?
Absolutely. So my original career after graduate school was in the mental health field. I spent over 20 years as a licensed clinical professional counselor, and I still have my license, so I still have that background basically. And I also have what's called an RDDP, which is a registered dual disorder professional certification, and that is related to substance abuse counseling. So add those together, and I have a lot of experience working with people who are struggling with mental health issues, as well as substance abuse and chemical dependency issues.
Very good. Now, you know, we're obviously going through some very odd times in the world today.
Yes.
And the pandemic, although, you know, we're at various stages, different states are seeing different things at different times, it's certainly been traumatic for people.
Yes.
I think it's been traumatic overall for society and also for families and individuals. Can you address that? How are people responding? Can you give us any advice how to view this situation?
Absolutely. When this all started, you know, back in kind of late February, early March, I myself didn't even understand the magnitude of what we were about to deal with. And but now that we're in the thick of it, and it doesn't seem to be going away anytime soon, we're really seeing the ramifications on people's mental health. And I, for one, am seeing it with my loved ones. I'm seeing it with my friends and family, the mental health struggles that we're going through. And I really, truly believe that we are, many of us, maybe not everybody, but many of us have been traumatized by this. You use the word trauma, and I really do believe that this is a traumatic experience that we're going through. When you think about what's happened, if you've gotten COVID and the illness and then the symptoms that it presents, God forbid you have a loved one that got it and ended up in the hospital or passing away from it, losing your job, you know, having financial difficulties, the fear of going out in public, being able, you know, you used to go to the store, it was no big deal. You went to Jewel, you went to Target, you did your thing. And now that's become scary because you have to, you know, think about social distancing, and you have to wear the mask, and you're not supposed to be touching people and all of that sort of thing. So the life as we knew it for decades and decades and centuries is no longer existing. And
Right.
we have to figure out how to deal with this. And when you can't see your loved ones in nursing homes, and you can't just pick up and go, you can't go on a trip. I had to cancel a trip. So many people, their livelihoods have been affected by this. In addition, like we said, but their finances, their jobs, and so on. This has become absolutely traumatic. Now, post-traumatic stress disorder, as probably everybody knows, is a diagnosable mental illness that's been studied and proven. There's lots of things that you can do for PTSD. And even though we may not have been in some sort of accident or a victim of a crime that would normally render the diagnosis of post-traumatic stress disorder, we still have been traumatized by all of this. I really, truly believe that.
Mm-hmm.
And so some of the things that we need to be thinking about, first of all, are taking ourselves seriously, how we feel, checking in with ourselves. How am I doing? Am I feeling blue all the time? Am I not doing things that I used to enjoy doing? Or am I have a startled response where everything is making me anxious and I can't concentrate and I can't focus and I'm not getting things done like I used to. Those two things are related to depression and to anxiety. If you're starting to feel that way, even starting to feel hopeless, helpless, like when is this going to end? The isolation that this has caused has really just done a number on our psyches. And if you were somebody that struggled with mental health issues before COVID, chances are your symptoms have probably exacerbated, intensified, and you're really struggling. You're really struggling.
So if you're out there today and you're listening and you're saying, hey, you know, I am struggling. If I really was honest with myself, I need to do something. What is it that you would recommend for someone to take some action steps?
Okay, so a few things that I would encourage. Number one is get a check on your expectations. You know, a lot of times we think we need to do and be productive and help others and, you know, be there for other people, and we're not taking care of ourselves. We need to have kind of that come to Jesus meeting with ourselves about, am I taking care of myself? Where are my expectations? Am I doing too much? What am I asking of myself to do when right now we are in the middle of a major crisis? It's not just affecting our region and our country, but worldwide.
Worldwide, okay.
Absolutely. So what are our expectations? What am I telling myself about how I should be feeling, what I should be doing during a time like this? Because a lot of times we put the standards super, super high when we need to lower the bar a little bit and allow ourselves to feel bad, allow ourselves to maybe even feel sorry for ourselves for a little while. There's nothing wrong with that. We just don't want to stay in that place.
Right.
And again, just kind of get a handle on where am I right now and what are my expectations.
So let's say we do that, but at what point do we reach out and get help?
Absolutely. We reach out to get help when it becomes, how do I want to say, it's really interrupting our daily routine. It's interrupting our ability to be productive. It's interrupting our ability to be where we were before. You know, we would be able to get these things done before when there wasn't a pandemic, but now I'm really struggling. My mood, you know, check your mood too. If your mood is down most of the time, when you can't find joy in the little things that you used to enjoy, when you can't smile at things, when you can't laugh, when you can't relax, those are some signs that suggest that it might be time to talk to somebody. And so where do I go for that? I mean, that's another question too, right? When people not even sure where it is that they go.
Where do they start, right?
Yeah, where do they start? Well, first of all, if you are employed, if you're one of the lucky ones who still has a job, bigger companies have employee assistance programs that are free to their employees. So if you have this available to you with your employer, definitely take advantage of that. Call your HR department if you're not sure if you have one, but they'll guide you and give you the number. And again, employee assistance programs are free to employees, and they usually give you anywhere from like 5 to 8 free sessions with a clinician, with a licensed mental health clinician. Now, if you are an employee that doesn't have that kind of benefit, which a lot of small companies don't have, then that's what Google is for. You can find lower paying or lower feed clinicians in your area. You can go on Psychology Today on their website and you can look for clinicians that way. You can Google, you know, and look for a therapist in Orland Park, Illinois, or whatever it is.
Right, and if you have insurance, you could also go and look for your policy and see if there's any providers that way as well.
Absolutely, yes. I was going to get to that too.
Yeah.
Yeah, it was great minds think alike. So yes, and if you do have insurance, definitely use your benefits. I know a lot of people are afraid of their employers finding out and so on, but your information is absolutely still confidential. And so there's nothing to be afraid of there. Be afraid if you're not going for help. because things are not going to get any better anytime soon. We're seeing surges of the virus all over other parts of the country. We're going to be facing this again here, here in Illinois, probably in the fall. So we need to be strong, and why not have a clinician and somebody that you can talk to on your side?
Absolutely, because I think there is help out there. You just have to reach out and figure out what that's going to be. And I think sometimes taking that first step for people is really the hardest thing. And then they feel better and think, well, why didn't I do this a long time ago? You know what I mean?
Mm-hmm. Oh,
and so that would be a good approach.
Night and day, being able to talk to somebody, getting your feelings out, finding out that you're not crazy, that you are a normal person experiencing a normal reaction to a pandemic that none of us were prepared for. None of us. But clinicians know how to deal with trauma. They know how to deal with anxiety and depression that comes from trauma. Let them help you. Let them help you. And if that's not an option at all for you, then I really encourage you to talk to your friends and create a support network for yourself, or engage in behaviors and do things that bring some joy to you. Whether it's relaxing, a massage, taking a walk, whatever it happens to be for you. Maybe it's reading the Bible or just reading in general, being out in nature, whatever it happens to be. Start forcing yourself to engage in those types of activities, because once you get in the momentum of doing that and it becomes more of a routine, you'll see some changes. You'll start to see more hope being built. You'll start to see that you're looking at things through the rose-colored part of the glasses instead of the dark-colored part of the glasses.
And I think it was important for everybody to listen today that this isn't over. I mean, it's something that we're going to have to deal with. It just doesn't vanish one day. It's not gone. We may have to learn to live with different conditions and different levels of it. On the other hand, it may resurge. There's a lot of different possibilities out there. So you can't just live hoping that it's going to end, because that's not a way to live, right?
Right. No. And we have to come up with a way to deal with this. All of us do. It's a brand new way of living that none of us have asked for, but we have to make lemonade out of lemons, kind of a thing. Right. I know that's kind of a cliche type of thing, but we really, really do. And I just want to really encourage people who are struggling to know that you are not alone by any stretch. There are so many people that are really struggling with this. Some people more than others. Some people may not seem to be affected, but you are certainly not alone. And it's important for you to take your feelings and your reactions to this very, very seriously. Don't poo-poo it and say, oh, I'll be fine in a few days. If you're having trouble getting out of bed in the morning, if you're losing weight, if you're not sleeping, all of those types of things also could indicate that you need somebody to talk to or some sort of intervention.
Sure. It's really about helping yourself and taking that first step. So if you're out there listening today, and Alexandra, they want to get a hold of you and say, can you help me? Can you help me get to that next step? How can they reach out to you?
Absolutely. You can email me at Alexandra, that's ALEX.G, like girl, at Comcast.net. Or you're even welcome to call me at 708-204-7228. And then you can go on my website also, which is glumacconsulting.com. That's GLUMAC consulting.com.
That's wonderful, because it gives opportunities. And, maybe somebody listened today and they have another idea and they want to get some, get in contact with you and get some advice to see if you think it's a good idea. All they have to do is pick up the phone, right? Yep.
Yeah, happy to help. And even though I'm still a clinician, I don't do private practice or anything like that, but I can certainly give you, whoever is in need, some resources and ideas of where to go.
And that's half the battle, because people sit back, they feel paralyzed, they feel like they can't take that first step. And that's why we're doing this today. So if you're listening today and you're struggling with whatever issue it may be, reach out. You can call Alexandra. She's going to give you some guidance to be able to take that first step to move forward with your life. We appreciate your time today so much.
My pleasure.